Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I am a board-certified gastroenterologist practicing in the wonderful state of New York. Today I'm here to talk to you about colonoscopy prep. So, colonoscopy prep is very important if you want to get a colonoscopy, because you have to be cleaned out so we can see what's inside and prevent cancer and find polyps. And this is a discussion that I have with patients lots of times a day, many times a day, so many times that I feel like I can probably tell it to you in 30 seconds from memory. But I don't want to do that because it's really boring and nobody wants to hear a 30-second micro machine-like podcast. So we'll go through some more details about prep. So if you're having trouble or are thinking about a colonoscopy and need to know what the prep's all about, you can come listen here and learn all about it. So what's up with colon cancer screening in general? Well, it's important. Colorectal cancer, which is cancer in the large intestine or in the rectum, which is part of the large intestine, so collectively it's called colorectal cancer. It's a really common cancer. We estimate that in 2024, more than 150,000 people will be diagnosed with colorectal cancer. That's men and women together. And in someone's lifetime, if you're a man, you have about a 1 in 23 chance of developing colorectal cancer. And if you're a woman, it's about 1 in 25. So if you know about 25 people, statistically, one person you know will have colon cancer. And we all know hundreds of people. So we all know people with colon cancer. And the tragedy with colon cancer is that for most people, it's preventable if you catch it early enough. And unfortunately, the risk of colon cancer is going up in younger people. So not all of colon cancer is preventable with screening because we don't really start screening until the age of 45 in the average risk person. Meaning if you have no family history, if you have no symptoms, and you're 45 and above, you should come in for screening. But the tragedy is that people are getting diagnosed earlier than that, and they're not coming in for screening because they're too young. So if you're under the age of 50, colon cancer, if you're a man under the age of 50, colon cancer is now the number one cause of cancer death. And if you're a woman under the age of 50, colon cancer is now the number 2 cause of cancer death. And that's relatively new. So it's going up. Since the 1990s, the risk in young people under 50 to 55 years of age or so, depending on the study you look at, colorectal cancer is actually increasing in that young age group. And there's a million reasons why that might be, and we'll talk about that another time. But the important thing is to get screened. And on a recent episode, I talked all about colorectal cancer screening using colonoscopy or non-invasive testing like stool testing and even blood testing now. So if you want to go back and listen to that, I'll put a link below for more details. But say you've decided on a colonoscopy, which is the gold standard test and the best test to prevent colon cancer. Well, you have to know about the prep. That's part of the procedure. It's actually the most important part of the procedure that you have control over is the prep. So let's look at a case. And there's no disclaimer here because this is just a random case that I made up, but it's the same thing that I see all the time, so it's real. We're going to talk about John. John's 47. He came in for his first screening colonoscopy. He came in for a pre-procedure visit where we say hello, talk to him about colonoscopy, take the history, make sure everything's good, learn about his medications, learn about his health history and his family history, and figure out if screening colonoscopy is the right test for him, and more importantly, educate him about the test and what to expect and what the risks, benefits, alternatives are, etc. So he came in, he has no symptoms and no family history, and he just was told by his primary care doctor to get a colonoscopy. And he's been told for a couple of years now, but he decided like third time's a charm or second time's a charm, and he's going to get it done, which is actually pretty common. People start coming in like 47, 48, saying that my doctor's been telling me for a couple of years to do this, and I figured I might as well do it. Like, 3 times. He told me 3 times. I got to come in and do it now. So why colonoscopy in the first place? What are we trying to do here? We're trying to prevent cancer. We know colon cancer is unique because it starts as a small growth in the colon called a polyp. And lots of people get polyps. And the unique thing is not that people get polyps, but it is that we can go in and find the polyps and remove them without having to cut someone open. So many other cancers are, in theory, things that you can screen for, but the intervention to remove the precancerous growth is a big deal. So pancreatic cancer, for example, you can screen for that. You can do lots of CAT scans and other advanced imaging techniques and other tests. But what do you do when you find a small cyst inside someone's pancreas? Are you going to take everyone to the OR and take out that part of the pancreas? You'll actually end up hurting more people than helping. And there's a lot of nuance to that, obviously. But for colorectal cancer, luckily we have easy access to the colon because you can go in through the anus and get into the colon very easily with a scope. And now you're looking right at the colon, and there's no cutting involved, and the person's asleep for it, and they wake up, and it's painless and pretty cool that we can go in and do this. So why a colonoscopy? It's all about prevention, especially in the younger age group. We're looking for polyps, which turn into cancer. And if we take the polyps out, then the cancer doesn't happen. In terms of what a polyp is, it's a little growth inside the colon, and over years, it accumulates changes in the DNA called mutations, and these mutations tend to favor the polyp turning into cancer. And once a polyp has accumulated enough critical mutations in the DNA, it becomes invasive, and the polyp tissue now is not polyp anymore, it's cancer, and it starts to grow into the colon wall and invade lymph nodes and blood vessels and organs, and now you have full-blown colon cancer. So we know lots of people have polyps because there's been lots of studies done on this, and if you take average risk individuals and do colonoscopies on them, meaning people with no family history, no symptoms, no prior polyps, if you're doing a good job and you're looking for polyps, the bare minimum percent of people you're supposed to find with polyps is about 25% of all comers. So that's men and women together. If you're looking at the different sexes, men have polyps about 30% of the time on their first screening colonoscopy, and women have polyps about 20% of the time on their first screening colonoscopy. And that's bare minimum numbers. So if you're not finding at least 30% of men and 20% of women with polyps on their first colonoscopy, then you're not looking. You're not finding the polyps. They're there. We know they're there out in the community. We have the baseline rate. So that's the bare minimum. You're supposed to be finding polyps at least that often. And if you're going somewhere good and getting a high quality exam done, meaning the endoscopist, the person doing the procedure, is looking carefully, spending enough time, making sure your bowel's cleaned out, using good technique, and has good eyes for polyps, you should be finding a lot more than that. Or the numbers should be a lot higher than that. And in my practice here, we track the number like you're supposed to do. And our number for what's called the adenoma detection rate, meaning the percent of people coming in for screening that have at least one precancerous polyp, is between 45 and a little higher than that every year that we check. That's a pretty good number. 45 to 50% is up there. And there's some studies that show that the number could go even higher, the low 50s potentially. But this number is very important because the higher the chance of your doctor finding polyps, the higher the protection that's granted from the colonoscopy is. So if you have a doctor that doesn't find polyps very often, and you have a polyp and it's missed, then you didn't get protected by anything, and you had a colonoscopy that was kind of a waste of time. All risk, no reward. But if you have a doctor that's finding the polyps if they're there, meaning if you have a polyp, it's going to be found and removed, then the protection of that colonoscopy is very high, and it brings down your risk of getting colon cancer to extremely low numbers. So how's it done? Well, you pick a doctor, you find someone online, word of mouth, family suggestion, your primary care doctor sends you in, you Google gastroenterologist near me or colonoscopy near me, and you find a doctor that does colonoscopy. Usually you meet that person in the office and you talk about the procedure and you book it. And the discussion that I have, and everyone does this probably differently, is that all the stuff above in less detail, like, hey, you're here, we're going to prevent colon cancer, colonoscopy is the way to do it. The way it works is by removing a small precancerous growth called a polyp from your colon. Polyps are found in a certain percentage of the population with no symptoms. The point of the colonoscopy is we go in and see if you have polyps and then remove the polyps if you have them. This way they can't turn into cancer as you get older. The procedure itself takes about 15 to 20 minutes. You're asleep for the whole thing. You get some moderate sedation given by an anesthesiologist. They're monitoring you the whole time, keeping you comfortable. The procedure is painless. When you wake up, you should feel well. You should not have any belly pain. The procedure is done in the office. You have to have someone drive you. You can't drive a car. We talk about prep instructions, which I'm going to go into in a minute. We talk about taking the day off work, not making any important appointments that day besides the colonoscopy, and making sure that they understand the alternatives to colonoscopy like Cologuard testing and other testing, and the risks of colonoscopy, which is cited as a less than 1 in 1,000 chance of a serious problem. And in reality, it's even lower than that in good hands. We talk about medications that people are on. We talk about blood thinning medications, especially, and any other medicines that need to be stopped or modified, like the newer weight loss medicines, the GLP-1 agonists, that's Ozempic, Mounjaro, etc. And we talk about diabetes medications. We talk about taking iron pills. If they're taking them, they have to stop those. So we review all that stuff during the first colonoscopy pre-procedure appointment. And on a side note, I should mention that some insurance companies are not advocating for these appointments to happen. They are not paying for these appointments to happen. And it's really a disservice to patients. And insurance companies are not in the business of serving patients in general. They make money by not serving patients. So, the issue with them cutting services like this is really just ridiculous. But we talk a lot about a colonoscopy on your first appointment. How can you just show up for an invasive test and not know anything about it, not be counseled appropriately? How do I know if you're on the right medicines, or if it's safe, or if I have to go over the instructions with you different ways, or if you need a special prep? Like, there's no way to know that stuff before you come in for your pre-procedure appointment. So unfortunately, insurance thinks that that's a luxury, but it's really actually part of the procedure, is having you understand the procedure you're going for and talking about it. But anyway, that's a side note. We could talk about that all day. When do you start colonoscopies? Well, for the average person, it's 45 years of age. Men and women, 45 years of age. So when you turn 45, you're supposed to come in for a colonoscopy or some other colon cancer screening test, but colonoscopy is the best. You do it earlier if you have family history. You do a colonoscopy at other ages if you have symptoms. So there's no age if you have rectal bleeding or some other issue, chronic diarrhea, etc. We do colonoscopy a lot earlier than that. But if you're doing it just for screening, just for prevention purposes, no family history and no high-risk symptoms or anything like that, you do it at the age of 45, and you do it every 10 years or so. And you do it earlier if you have a polyp found or some other condition. So if you're the average person, you come in for a colonoscopy, it comes back normal, you did a good job with the clean out, you don't have to do it again for 10 years. It prevents you from getting colon cancer for 10 years. It's a pretty good bargain. So how do we talk about the prep, and how do I discuss it so that people do a good job? Because the worst is when you come in for a colonoscopy and you don't have good prep. I can't see what I'm doing. You get no benefit from the protection because I can't see anything, and we have to reschedule it again. It's literally a situation that nobody wants. So the way I instruct people about the prep is, first we talk about what the prep does. It's either a liquid that you drink or it's pills that you take, and the purpose of the prep is to clean out the stool that is inside your colon. So if you take a liquid prep, it kind of flushes all the stool out. You end up going to the bathroom a lot until the point when you are passing clear water at the end. And when you're passing clear water, then you're basically cleaned out and you're good to go for a colonoscopy. And the average person, even because people come in saying like, oh, I didn't eat for 2 days, I should be clean. But that's not true, because your colon doesn't just like self-cleanse like that. You have stool inside your colon. You need something to actually flush it out to be clean enough for a colonoscopy. So you can't just fast for a couple of days. You actually have to do a active clean out process called prep or preparation. And there's a bunch of prescription products out there that are made just for this, and there's other over-the-counter alternatives. So let's go into it a little bit. But the take-home message is that you have to do the prep. It's very important to see what's going on. And without a good prep, you're really doing yourself a disservice. And I cannot see polyps if I can't see the colon lining. So we talk about different preferences in terms of prep. I don't really have a huge preference in terms of preps that people take, as long as they work. So as long as you take a prep that actually does the job, I'm happy with that. And a lot of it's patient preference and insurance coverage. So there was just a recent little article out about people paying out of pocket for colonoscopy prep. So there's a federal law that insurance companies have to cover screening tests like colon cancer screening starting at age 45. But there's interesting things about prep out there. Like, they don't have to cover the prep, or they can cover the disgusting old archaic preps from the 1980s that are now used as forms of torture. There's plenty of better preps out there, and they don't necessarily cover those. So a lot of patients still have to pay something or the full price for the prep out of pocket, which is kind of a bummer. Some of these good preps are in the few $100 range if you wanted to pick them up from the pharmacy and pay out of pocket. And this study showed that only 17% of patients pay nothing for their bowel prep for a routine screening colonoscopy, and a lot of people were shifted toward over-the-counter Miralax prep, so that number is actually much higher in terms of people who paid something out of pocket probably. So when I'm discussing prep, I often will look at the patient's insurance and see which prep is covered before we really get into the instructions, because every brand has a little bit of a different instruction on how to do it. I ask patients if they have any preference between pills and liquids, because there is a good pill prep that's called Sutab that's approved and has been used now for several years, and lots of people like that prep. But some people hate pills. They just don't want to take pills. It's 24 pills you have to take. So I'll ask them if they like pills or not. If they don't want to do pills, then we go with one of the liquid preps, the lower volume, more modernized liquid preps. And there's many different brands available. I'm kind of brand agnostic. As long as it does the trick, I don't really necessarily care which one you take, because as long as it's effective and tolerable and you can get it from your pharmacy and it doesn't cost you $300, I'm happy with that. So if neither one of these situations is happening and your insurance doesn't cover any good preps besides disgusting old Go Lightly 4 liters of saltwater prep from 1982, and if you can't do the pills or don't want to do the pills, then we also talk about alternative preps like Miralax prep or magnesium citrate preps. But these are over-the-counter preps, and they're not really either FDA approved for bowel prep or really the best preps out there. But they're good alternatives, and we use them occasionally. As a side note, I actually made a bunch of videos that are on YouTube in terms of bowel prep. I have a good video on how to take liquid preps, and a good video on how to use pill preps, and a good video on how to make your own Miralax prep at home, and a video on how to troubleshoot prep problems. So when you're doing the prep, it's not working, or it's intolerable, or you're vomiting, or whatever the issue is, or it didn't clean you out in time. I made videos for all these situations, and they're actually pretty popular on YouTube. I have a lot of views on these videos, and so clearly it's a problem that people have. And the comments are awesome too. There's so many comments, and some of them are great because they offer actually really good insight, and people will leave their experiences on how they do the prep, and some of the stuff is very helpful, and some of them are just funny and entertaining too. And there's a lot of colonoscopy haters out there in the comments, and that's understandable, but realize that it's actually for your own good. We're not doing it to torture you. So go check out YouTube. I'll link those videos in the show notes, and you can see whatever prep you were prescribed. If you're listening to this podcast and you're sitting there looking at a bowel prep that you have to do in the next day or two, you might want to go to one of those videos and look at them because I think they're helpful. But here are some tips that I give people for doing the prep. And this is kind of the counseling that you get here in the office, but it's good to have in summarized fashion here as well. So some things to just have in general before you do a colonoscopy prep, like you should have this in your house before you even think about it. Couple things. One is you want to have a working toilet situation. So I've heard funny stories where people get a colonoscopy scheduled for whatever day and they forgot they were having their bathroom remodeled, or they have relatives coming in out of town using one of their guest bathrooms, or whatever the situation is, and they don't actually have a comfortable place to use for the prep. And you really just want to have a dedicated bathroom situation the day you're doing the prep. You don't want to be sharing a bathroom with your relatives from out of town. That's really not cool for them and for you. And you don't want to have your plumbing being worked on that day. That's not a great situation either. So make sure you have a normal working toilet, which most people have. You want to free up your schedule. Lots of people try to do their bowel preps when their kids have a basketball game or a lacrosse game or whatever it is that night, or they have to drive their kids around, or they have work responsibilities that night. That's not going to happen. Once that prep takes a hold of you, there's really nothing else you can do. At that time, you really have to have free access to a bathroom that's within 10 feet. Otherwise, bad stuff's going to happen. And you have to have toilet paper. So that's a good thing to have on hand as well. You should probably have that in general at your home. Make sure you have some good toilet paper and you have a bunch of it. Some people like to have some type of cream for their sore butts after a colonoscopy prep. Zinc oxide or Desitin is often a good thing to have around, and people use all kinds of other creams, but something to help a sore butt on the day before your colonoscopy is sometimes appreciated. Not always an issue, but you'd rather have it and not need it than not have it and need it. And when you start doing the prep, you can't really go out to the drugstore and get something because you're going to be stuck to your toilet for a while. And the other thing I should mention is you should have clear liquids in the house. So lots of clear liquids that you enjoy drinking. So that could be Gatorade or Pedialyte or water. It could be white grape juice or apple juice, or even iced tea is fine to use. You want to have something that you don't mind drinking a large quantity of. You're going to get very thirsty, and you have to have a lot of clear liquids to stay hydrated. So make sure you have all that stuff in your house, as well as the rest of these tips, which we'll go through. The first tip is really to make sure you get the prep a few days ahead of time. Don't wait until the night before your colonoscopy, 10 minutes before you're supposed to start the prep, to go to the drugstore and get it. And then you find out that either the prescription was returned or canceled because I sent it 3 months before, or your insurance doesn't cover it, or it's out of stock and it covers it, but they don't have it in the pharmacy, because then you're kind of out of luck. And then you have to cancel your procedure, or you have to call the doctor at some late hour, and it's just not a good situation. You should have avoided that by just doing it a couple days ahead of time. So get your prep a few days before, put it on your kitchen counter and just stare it down for a few days and show it who's boss. So that's tip number 1. Tip number 2 is really just to be clear on the bowel prep instructions. So in my office, I give you brief instructions. I have a dedicated person who will give you full instructions, both verbally and go through the written instructions that we give you. That's usually decent, and then we'll call you a few days before the procedure and ask you if you have other questions, review them again with you in terms of what time to take the prep and what to expect. But be clear on these instructions. Go home, read the instructions again. If you have questions, ask them, call the doctor's office and ask them early. Don't wait till the night before and just try to wing it. Much better to have a clear plan. So the third tip is you have to see what is going on in the week prior and see if you have to hold any medications. So look at the instructions. Your doctor should have given you instructions on how to hold certain medications, diabetes medicines, blood thinning medicines, iron, and some other medicines need to be held or adjusted prior to a colonoscopy because you're fasting and you're doing a prep. And there's a lot of reasons why we hold certain medicines or adjust them. So make sure that that's clear if you're taking medications. Make sure your doctor kind of addressed your medicines with you before the procedure. The same goes for medicines that you should not hold. So you should not hold your blood pressure medicines. And if you have cardiac disease or if you have some reason to be on aspirin, do not hold your aspirin for a colonoscopy. That's old thinking. You're supposed to stay on your aspirin. It reduces the risk of problems for your heart and having strokes and other issues if you just stay on your aspirin. It's a very low risk of bleeding. So make sure that's clear though. Make sure you ask your doctor and make sure that stuff is covered before you leave the office. And if you have any questions, call the office about those kind of problems. And don't wait till the night before and don't just make it up as you go along. Also, make sure that your ride is arranged. Make sure that whoever's bringing you for the procedure is free and off that day and ready to drive you. And you're not scrambling the night before for a ride and trying to cancel your appointment. Or worse, you show up with no ride and we cancel you because we can't give you sedation if you don't have a ride. So make sure all those logistical things are figured out well in advance. Tip 4 is the day before. Make sure you reread the instructions. Make sure you know what's going on the morning before your colonoscopy. Don't eat 3 meals that day and realize that you're supposed to be fasting all day, for example. The instructions will often tell you to mix the prep ahead of time. I often tell people to put the prep in the fridge to make it cold because it's easier to drink when it's cold. You don't taste it as much. So mix and chill the prep ahead of time, maybe before you go to work, so that it's ready to go when you get home. Make sure that you're clear on your special diet, whether it's a low fiber, light breakfast, or if just clear liquids are recommended. So make sure that you know what's up that morning before the colonoscopy so you follow the right diet and don't eat a high fiber breakfast full of berries and nuts and seeds when you weren't supposed to. And actually, I should add to my previous tip that the diet changes that you have to do before a colonoscopy also include cutting out seeds, nuts, berries, and other such roughage a few days before your colonoscopy, because that stuff can stick around inside your colon for days and days and days. And it particularly is annoying because it can clog the scope and you can't suction properly, even with little tiny seeds in there. Like if you ate a whole bunch of blackberries and chia seeds and other things like that for breakfast 2 or 3 days before, it can sometimes be a problem. So make sure you cut that stuff out of your diet 2 to 3 days prior. Okay, so back to the next step. Now we're up to number 5. The next tip, I should say, we're up to number 5. You want to make sure that you drink the prep at a speed that makes sense per the instructions you were given. So if you're sipping the prep like a fine champagne, it's not necessarily going to work as well as if you drink it faster. But if you drink it faster, you can get queasy and throw up. So you want to drink it at a rate that is acceptable for the prep that you're taking. And every prep's a little different. Most preps, you can kind of drink 1 8-ounce cup of the prep every 15 minutes or so, but sometimes you have to drink it faster, sometimes you have to drink it slower. But that's pretty much a normal rate for a prep. So you set your timer and you drink about a cup, not like a giant glass, but 1 8-ounce cup of the prep every 15 minutes or so until it's gone. But pay attention to the instructions you were given. It should have a rate at which you have to drink the prep. And in my videos that I have in terms of how to troubleshoot your prep if it's not working, some people get nauseous and they can't keep drinking at that rate. And if you do try to force your body to drink at that rate, your body will shut it down and you'll throw up. So listen to your body and listen to the way you're feeling. And if the instructions tell you to drink a cup of prep every 15 minutes, but you feel like if you drink 2 more sips, you're going to throw up, then put it on pause. Just wait. It's okay. You can wait and let the prep kind of pass through. And when you start to feel less full, give it a half an hour or so, then you can start again and just take it from there. So there are the instructions and there's also the things you have to do to modify it. And that's one of the reasons why I have that video, but some of it's just common sense. If you're drinking too fast and you feel like you're going to throw up, stop. Because oftentimes that feeling builds over time, even when you stopped. So the earlier you stop, the better in terms of getting nauseous and full from the prep. Most people should expect, and this is now up to tip number 6. I'm not sure why I labeled these, but I did with numbers. But tip number 6 is you should expect to start going to the bathroom about 30 minutes or so after you start your first dose of the prep. And that is super variable. So some people don't go to the bathroom for 2 hours after they drink their first dose of prep. Some people finish the entire first liter of prep with all the water afterwards that they're supposed to drink, and nothing happens for 3 hours. And some people smell the scent of the prep and they poop in their pants. So it's not, well, that's kind of an overstatement. Most people don't poop in their pants. But what you should know is that it's a variable window depending on how fast your bowels are moving, but most of the time you should expect to have something going on, some rumbling or some type of movement within 30 minutes to an hour or so of when you start the first dose of prep. If you haven't gone in a few hours, that's a good reason to see my video on troubleshooting prep and to figure out what to do, or to call earlier in the evening and ask what to do instead of waiting till midnight when nothing's happened and then trying to call your doctor at midnight. That's not the best thing to do. Tip number 7 is that the most bowel preps are now split dosed, meaning that you take some the night before and some later that night or early the next morning. That's called split dosing, as opposed to drinking it all in one shot. And realize that the second dose of the bowel prep is just as important as the first dose. So the second dose of prep really is what does that like rinse cycle in your colon, if your colon's a dishwasher, and the first dose really does the cleaning and the second dose really does the rinsing. So if people who don't do the second dose think they're fooling the doctor, they're really not, because when you come in the next day for your procedure and you say, yeah, I'm all clear, and then you look in there, what I see is all this gunk stuck to the colon wall, all this bile and digestive juices and some residual stool that wasn't really properly rinsed off the colon wall from that second dose. So first dose, you might have some clear stool after that, but often there's still stuff, digested stuff above that, digestive juices, pancreatic secretions, gastric secretions, bile, and just undigested gunk that's still hanging out in your intestine that needs to be flushed out with that second dose of prep. So the second dose, just as important as the first dose. Please finish both doses for optimal results. And my last tip here is make sure you get sleep. Most likely you want to get the prep done a little earlier in the evening, get some sleep, and have a good night's sleep the night before the procedure. Most people fear that they're going to wake up at night and poop in their bed, and that doesn't really happen. Most of the time, if you do your colonoscopy prep properly and follow the times and you have good normal bowel transit, you don't do that. You don't poop your sheets. That's not fun for anybody. Spouse usually doesn't like it so much. Not great for your bedding, and leaves a lingering odor in the room that's just hard to get rid of, I got to tell you. But if you do the prep properly and you do it early enough in the night, you're basically empty. You're not going to go to the bathroom at night. Or maybe you'll have to go and your body will wake you up. You'll know you'll have to go and you'll go to the bathroom. With the split dose prep, it's even better. So if you're coming in for a procedure a little later in the morning, so for example, if your procedure is scheduled on a Friday morning at like 10 o'clock or something like that, or 11 o'clock in the morning, and you do split dose prep, which is the optimal way to do it, you drink the first half of the prep the night before around 5 or 6 p.m. You're done with that prep and you're done with all the movements by 10 o'clock at night or something like that, and you can get a good night's sleep. You wake up really early, 5 a.m., you chug the other liter of prep or whatever your prep calls for around 5 a.m., and you're done. And then you come into the office and do the procedure around 10 or 11, whatever time we gave you, and you don't have that problem with nocturnal awakening to move your bowels. So that's the best way to do it if you have a mid-morning procedure. Wait, did I say that was the last tip? I'm wrong. There's one more. Don't eat or drink anything in the morning of the procedure unless you have prep on the menu as instructed by your doctor's office. So every once in a while, we have someone come in for their colonoscopy. They did the entire prep exactly how they were supposed to. They showed up on time. They're all ready to go. We say, hey, what was the last thing you had to eat or drink? Because we have to ask everyone that question before they get anesthesia. And they say, I had a cup of coffee with milk in it on the way here this morning. Or I stopped on the way here and grabbed a roll or a cookie or whatever. It sounds absurd, but it does happen every once in a while. That obviously is a big no-no. Your bowel prep's not going to be good if you have a cookie inside your colon. And we can't give you anesthesia if you just ate. So it's not going to be a great experience. And most people choose to cancel at that point. And somehow they always blame me for telling them they couldn't eat. But that's not true. We tell you about 18 times that you can't eat. So don't eat the morning of your procedure. Split dose bowel prep does not count as food. But if you're doing some prep the morning of your procedure as you were instructed, you have to make sure you start that prep 5 hours before your procedure. And that you finish the last drop of that prep at least 2 hours before your procedure. Preferably more time than that. And you can't have other clears that morning with your prep as you could the night before. So the morning of the procedure, you cannot have Jell-O, you cannot have Italian ices, you can't have anything like that. The only thing you can have is the water that you're supposed to take with your prep. And you have to finish all of that at least 2 hours before. And the way I try to phrase it is that not a drop of anything can pass your lips. That is not a drop of water, not a candy, not a sip of a Gatorade. Nothing whatsoever should pass your lips after you finish that prep. From the time you finish the prep, at least 2 hours before your procedure. So if you finish your last drop of prep at 7 a.m. and your procedure is scheduled for 9:30, don't have anything from that 7 a.m. time to 9:30. So in conclusion, colon cancer is very preventable with proper screening. Selecting a good doctor who finds adenomas and polyps is very important to get a good quality screening. And the thing that you have the most control over is how you do your bowel preparation. And if you do a really good preparation, then typically you'll have a more high quality result of your test, meaning that if you have a polyp, the doctor will be able to find it. And almost everybody can do a bowel prep. The thing here is that some people just need a lot of TLC. So not everyone can follow the exact cookie cutter recipe for bowel prep. Some people throw up, some people have belly pain, some people can't tolerate the taste, some people can't swallow pills, some people have very slow colon motility, they're very constipated, they need a little extra something. But almost everyone, if you do it properly, can do a bowel prep. It just takes time to talk it over with your doctor beforehand and figure out a plan. And sometimes that plan is taking a couple of laxatives a few days before. Sometimes that plan is working on the underlying constipation problems before you sign up for the colonoscopy and fixing that first. Sometimes that plan is prescribing anti-nausea medicines to take with the prep, or doing the prep at different time intervals than we discussed here. And that's all why it's important to come see your doctor beforehand and talk about these things, and not just show up for your colonoscopy with no pre-procedure visit like the insurance companies want you to do. So if you've had problems with bowel prep before, check out the video I have linked below about troubleshooting your bowel prep, or one of the other videos that I have linked below, because they're pretty helpful in terms of all the common issues that come up with prep. And at the end of the day, if you come in, you have a colonoscopy, you're 45, 50 years old or so, you come in for your colonoscopy, and you're one of those 45% of people or so that have a polyp in there, and we found it, removed it, you just reduce your risk of getting colon cancer for the next 10 years, which is pretty awesome. So you'll be happy about that, even though the prep is not always as much fun as I make it sound here. You'll be happy that you actually did the right thing and reduced your risk of getting one of the most common deadly cancers affecting young people nowadays. No non-invasive test comes close to the level of protection that colonoscopy gives you, so colonoscopy is the way to go. If you can't get a colonoscopy, won't get a colonoscopy, definitely do one of those non-invasive tests like Cologuard, or the new blood test that's out called Shield, or whatever other non-invasive test that you can do, but realize that you're sacrificing convenience for protection. That is the end of today's episode. I hope you enjoyed this information, and I hope it was helpful in terms of you getting a colonoscopy and understanding your bowel prep, and hopefully this helps you get through the procedure a little easier. If you have questions or tips on bowel preparation, please leave them for me in form of an audio message so I can share them with the world. Or if you want to go on one of the YouTube videos and leave a comment, that's great too. I do look at those comments every once in a while, but they're getting out of control, so I can't keep up with them, which is my humble brag as a YouTuber. But you can also find me on social media under Real GI Doc. And until next time, happy prepping and goodbye.
That's it for this episode of the Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.